The CEO of Pfizer is acknowledging that the effectiveness of its vaccine does decline over time. Here's what he said yesterday on CNBC.
There is a waning of the efficacy. The first 2 months was 97%. The second 2 months was 90% approximately, and the 4 to 6 months was approximately 84. We are very, very confident that a third dose, a booster, will take up the immune response to levels that will be enough to protect against the Delta variant.
I want to bring in Dr. Aditi Nerurkar, physician at Harvard Medical School. Doctor, good morning. We love when you join us. All right, this, I think, is one of those things that's getting frustrating for some people. I mean, if you have got the Pfizer vaccine in your body right now, you just want to know, should I be getting a third shot or not? We hear there the CEO of Pfizer not only saying that he thinks that you should get one, he's very, very confident that a booster shot would protect you more against the fast-spreading Delta variant. But then we have the CDC and the World Health Organization saying people do not need a third dose at that time. What's your take on this? What's your message to those who are listening right now who had the Pfizer vaccine? Do you think that they're going to be getting a booster shot?
You know, Savannah, there are three main considerations when we're hearing the Pfizer CEO remarks. The first is that the data is not peer-reviewed yet, and that's a really important consideration. The second is that same data that he's referring to, it showed 97% effectiveness at preventing severe illness 6 months out. And the third most important consideration, which you mentioned, is that neither the WHO nor the CDC have suggested boosters at this time. And as we know, it's so important during this pandemic to consider the source. We have to get our COVID news, our vaccine news, and policy decision making has to come from global and national health agencies and not from a CEO of a company.
That is a very, very good point, and one that can make people pretty confused when they hear a soundbite like that. Okay, doctor, now let's talk about breakthrough cases, those people who are fully vaccinated who then test positive for COVID-19. Now, before I say this number, I want to put into perspective here that millions of people have been vaccinated, but the CDC says more than 5,900 of these breakthrough cases that we've seen were patients who were hospitalized or died. What do you want the public to know about these breakthrough cases, especially as potential super spreader events like Lollapalooza we just heard from Shaq take place? What's kind of the takeaway here if you have been fully vaccinated?
So, Savannah, it's very tricky with these breakthrough infections because the CDC stopped tracking in May. They only track COVID cases, hospitalizations, and deaths. So we really do need to start tracking again, especially since the CDC recently changed their mask mandates, because we now know, based on the science, that the Delta variant can be spread by fully vaccinated people. Not all breakthrough infection risk is the same. Breakthrough infections are greatest in areas with low vaccination rates because there's a high circulating virus, and in people who are immunocompromised. We know that 44% of breakthrough infections are in those who are immunocompromised. So we really do need better tracking and measuring, especially if we're putting in public health mandates to see if these mandates are actually working.
Yeah, so let's talk about that mask mandate. What do you think about it? Is that return of that mandate necessary?
I was relieved and I was thrilled with the news. We really do need masking in areas of high prevalence of the Delta surge. You know, the CDC has 4 tiers: low, moderate, substantial, and high. And so right now they're recommending that in the substantial and high areas, which makes up for 2/3 of the country, we do really need to have masking. I think it really follows the science. And I know people are frustrated, but we know also that masking gives us our surest bet, for preventing COVID in children who aren't vaccinated and so many others who are at risk. So these mask mandates protect all people, including, of course, vaccinated people, but most importantly, unvaccinated people. We only have a 50% vaccination rate in this country. So we really do need to push for that as well.
Absolutely. Dr. Aditi Nerurkar, thank you so much.